Hello guys, Prof. 30 here, and welcome to my vlog. Today I'm going to give a lecture video for those of you especially who will take the Board Licensure Examination for guidance counselors. For this video, I'm going to discuss questions about counseling theories, tools, and techniques. Okay, so without further ado, let's begin. Are you ready? Question number 1. This is an important professional code in the counseling wherein the practitioner must have the knowledge to perform whatever service the profession offers. A. Informed consent. B. Unconditional positive regard. C. Competence. Or D. Empathy. Time is up. The correct answer is letter C. Competence. Letter A, informed consent, is not the correct answer because the goal of the practice of informed consent is to provide clients with the most relevant and accurate information regarding their own treatment so that they can decide for themselves to become involved and willing participants in their own therapy sessions. Basically, you just tell them their rights and responsibilities so that they can decide if they want to continue treatment with you or not. Usually, we do the informed consent at the start of the counseling relationship. Letter B, unconditional positive regard, is not the correct answer because this is a term used in humanistic psychotherapy by the name of Carl Rogers, although at the present, UPR is being applied to all therapeutic modality, okay? But it has started in humanistic psychology. Practicing UPR means accepting and respecting others as they are without judgment or evaluation. Letter D, empathy, is not the correct answer for this question because it is an expression of the regard and respect the counselor holds for the client whose experiences may be quite different from that of the counselor. Question number 2. This phenomenon occurs when clients push their unacceptable thoughts, feelings, or impulses outward onto another person. For example, Pedro angrily accused Maria of cheating while denying his unacceptable cheating acts. Let's assume that Maria has not cheated Pedro, or there were no evidence of Maria cheating Pedro. A. Projection. B. Reaction formation. C. Displacement. Or D. Repression. Time is up. The correct answer is letter A. Projection. Letter B. Reaction formation is not the correct answer because it is a behavior in which a person will attempt to hide his true feelings or desires by demonstrating or adopting the exact opposite feelings. Reaction formation is a type of psychological defense mechanism used to overcome the anxiety and stress caused by negative feelings. So a good example of this is, let's say you really hate your boss, you talk ill about them, you say bad things about them, but then when you actually talk to that same person, you're too nice to him. You're approachable, you help the person. It's like you are a different person when you're in front of your employer or your boss, which you talk ill at his back. So that's reaction formation. Displacement, letter C, is not the correct answer because this occurs when the individual shifts the aim of sexual or aggressive impulses from a more dangerous person or activity to a less dangerous person or activity. A good example of this is kicking your dog or venting anger towards your younger sibling because you can't afford to vent your anger to your boss. He might fire you. So, letter D, repression, is not the correct answer because this involves forgetting an emotionally painful memory. So, if you have an emotionally painful memory, instead of processing it to the conscious, you put it back right away to the unconscious. So, that's repression. Question number 3. The psychoanalytic psychotherapist lets the client lay on the couch while being asked to talk about anything that comes to mind throughout the session. Accordingly, this technique intends to discover emotionally charged materials that were repressed because it was painful to bring to consciousness. A. Dream analysis. B. Transference. C. Free association. Or D. Hypnosis. Time is up. The correct answer is letter C. Free association. Now, when we say dream analysis, this is basically interpretation of dreams, determine their underlying meanings. Freudian dream analysis relies on symbolism. It is based on the notion that your unconscious mind protects you from your repressed desires by expressing those desires in dreams and hiding them away from your conscious mind. Transference is not the correct answer for this question because this occurs when a client projects feelings about someone else, particularly someone encountered in childhood, onto her therapist. So there was a transfer of feelings to the therapist, even if that feeling came from someone else. Letter D, hypnosis, is usually performed by a trained therapist who utilizes visualization and verbal repetition to induce a hypnotic state. As you can see in our question, the therapist did not do anything to induce a hypnotic state to his or her client. Question number 4. The following are methods or techniques used in Adlerian therapy, except A. Dream analysis, B. Early recollections, C. Family constellation, or D. Dysfunctional thought record. Time is up. The correct answer is letter D. Dysfunctional thought record. For letter A, dreams are viewed as the royal road to the unconscious and thus developing dream analysis, interpreting the dreams to identify what are these unconscious influences that affect the present behavior or personality of your client. Early recollection is another technique used in Adlerian therapy because this is letting your client narrate single events from childhood, which the individual is able to reconstitute in present experience as mental pictures or as focused sensory memories. So as a therapist, Adlerian therapist, we try to see the connection of the present behavior and their early recollection. Family constellation represent the operation of the family system, including parents, siblings, and others in the family of origin, together with any others living with them as members of the person's childhood household. So you also look into that as an Adlerian therapist. While letter D is an Adlerian therapy technique, rather, because this is a tool used in cognitive behavior therapy or CBT. This is to help you or the client recognize and change their unhelpful thoughts. The purpose of this dysfunctional thought record is to get the client into the habit of paying attention to their thoughts and working to change them. Okay. Question number 5. Adler believed that this child is never dethroned, and so he may feel he should be treated like royalty. He is likely to have unrealistic aspirations. He dreams of being bigger and more powerful than everyone else, but usually does not have the follow-through to achieve these dreams. Is it A, oldest, B, middle, C, youngest, or D, only child? Time is up. The correct answer is letter C, youngest child. The oldest child may be initially spoiled and later dethroned upon the arrival of the second child. She may be bossy, strict, and authoritarian. It's as if she has a right to power. She also may feel exceptionally responsible for others. The oldest child may strongly identify with father because she turns to him for support after the birth of the second child. That's why. The middle child is likely to be even-tempered, developing a sort of take it or leave it attitude. She may become overly sensitive to the plights of others who are overlooked or underprivileged. She can feel cheated out of her position of privilege and harbor resentments, sometimes quietly manipulating others to achieve her ends. She may also have trouble finding her niche in life. The only child has plenty of attention from both parents and therefore feels special, especially liking attention from adults. There may be problems with peer relationships due to lack of experience with give and take and tolerance. May believe she should be taken care of. That's why we have the term called spoiled brat. Question number 6. When an individual in a family has problems, a therapist might help by examining family communication and relationship. What therapeutic modality is used? A. Gestalt therapy. B. Existential therapy. C. Family therapy. Or D. Solution-focused brief therapy. Time is up. The correct answer is letter C. Family therapy. Letter A, one of the major goals of Gestalt therapy is to help people work through their unfinished business and bring about closure. So that's the focus of Gestalt therapy, unfinished businesses and bring about closure. For letter B, the goal of existential therapy is to understand the way the clients sees the world and help them make choices based on this new insight. For letter D, solution-focused brief therapy is a goal-directed collaborative approach to psychotherapeutic change that is conducted through direct observation of clients' responses to a series of precisely constructed questions. As the name implies, the solution-focused brief therapist really focuses on the solution. Although they talk about the client's problem, but they are more concerned on what the client can do at the present to immediately solve the problem. I think this is also a giveaway question because we have a clue. The word family communication relationship actually gives way to the answer letter C. Question number 7. The following are examples of exception questions used in solution-focused brief therapy, except A. While you are sleeping, client, a genie did something to disappear your problem. When you wake up, what will be different? That will tell you the miracle happened and the problem is solved. Letter B. How did you avoid falling apart? Letter C. Tell me about times you felt happiest. Or letter D. On a scale of 1 to 10, with 10 representing the best it can be and 1 the worst, where would you say you are today? Time is up. The correct answer is letter C. Tell me about times you felt happiest. Now let's look at each of the statements one by one. Okay? Letter A, as you can see, is an example of a miracle question. So that's one technique used in SFBT or solution-focused brief therapy. The miracle question is a method or technique of questioning that a counselor uses to aid the client to envision how the future will be different when the problem is no longer present. Also, this may help to establish goals. Letter B is what we call a presupposing change question. And letter D is an example of a scaling question. Now, take note, in using scaling in therapy or counseling, this is a way to help your client break down their perception of their situation into grades. Once applied effectively, it can accomplish 3 things. 1, we put a fence around the experience so it no longer feels limitless or uncontrollable. The client can begin to see it as a more manageable and therefore more hopeful. Second, we engage the observing self and help the client step outside their experience. Scaling engages the thinking brain and loosens the grip of the emotional brain. And thirdly, we break down expectations and therapy strategy into discrete steps, rendering them more realistic and achievable. Question number 8. Based on the work of psychiatrist William Glasser in the mid-1960s, reality therapy is founded on the idea that everyone is seeking to fulfill 5 basic needs, and mental health issues arise when any of these needs are not being met. The 5 basic needs are the following, except A. Power, B. Love and belongingness, C. Freedom, or D. Self-actualization. Time is up. The correct answer is letter D, self-actualization. Actually, the 5 basic needs are survival, love and belongingness, power, freedom, and fun. Letter A, power. This is the client's sense of self-worth and achievement. Letter B, love and belongingness, as the name implies, is to feel as if you are being part of a family or community of loved ones. Letter C, freedom, talks about the client's independence or ability to make their own choices. Letter D, this is a word from Maslow's hierarchy of needs, which is the highest level of psychological development where the actualization of full potential is achieved, which occurs only after basic and mental needs have been fulfilled. Question number 9. With the help of the therapist, Robert realized some negative automatic thoughts of worthlessness and helplessness that are maintaining his depression. What counseling orientation is the therapist using? A. Cognitive behavior therapy. B. Rational emotive behavior therapy. C. Feminist therapy. Or D. Narrative therapy. Time is up. The correct answer is letter A, CBT or cognitive behavior therapy. Letter B is not the correct answer because REBT or rational emotive behavior therapy is a short-term form of psychotherapy that helps you identify not negative automatic thoughts, but they use the word self-defeating thoughts and feelings. Challenge the rationality of these feelings and replace them with healthier, more productive beliefs. So that is how REBT operates. Letter C is not the correct answer because the purpose of feminist therapy is helping the individual eliminate their thoughts and feelings on gender standard and encourage them to explore or create their own identity. For narrative therapy, it does not seek to transform the person in therapy. Instead, it aims to transform the effects of the problem. Its goal is to make space between a person and their issue. This makes it possible to see how a certain concern is serving a person rather than harming them. Question number 10. Clients are ready to terminate therapy when they understand the historical roots of their problems and when they have clarified how their early childhood problems are affecting them in the present. A. Multicultural counseling. B. Behavioral counseling. C. Adlerian counseling. Or D. Psychoanalytic counseling. Time is up. The correct answer is letter D. Psychoanalytic counseling. Letter A is not the correct answer because multicultural counseling involves therapists demonstrating an understanding of their patients and their struggles with cultural issues, racism, and other related experiences. Multicultural counseling also takes into account disabilities, health conditions, gender, sexual orientation, living conditions, and more. So, for example, if your therapist discuss all these things, most likely they are coming from the framework of multicultural counseling. Behavioral counseling is not the correct answer because this is focused on human behavior and looks to eradicate unwanted or maladaptive behavior. Typically, this type of therapy is used for those with behavioral problems or mental health conditions that involve unwanted behavior. So if you want to remove a particular negative behavior, then maybe a behavioral counselor can work for you. Adlerian therapy is not the correct answer because this is a psychoeducational approach that is both humanistic and goal-oriented. It emphasizes the individual's strivings for success, connectedness with others, and contributions to society as being hallmarks of mental health. Letter D is the correct answer because it always looks at the past experiences as early as childhood and be able to identify what is affecting them in the present. In psychoanalytic psychotherapy, the ultimate goal is to make the unconscious conscious. So the therapist will really dwell a lot on exploring the past. Okay, so we're done. What's your score? Tell me by writing your comments below. And thank you for listening. Don't forget to like and subscribe. And I promise you I'll do more of like this in the coming days. Thank you. Bye-bye.